Hello everyone, good evening. I'm Purnima from Fertility Dost, and today we have Dr. Puneet Arora with us. She is a director and senior infertility specialist CIFAR Gurgaon. Good evening, ma'am, and welcome to our forum Fertility Dost.
Good evening, Purnima. Thank you so much. Thank you to Fertility Those for having me. Thank you.
Thank you, ma'am. Pleasure is ours. And today with you, we are going to talk about IUI. हमने बहुत सुना है IUI छोटा सा वर्ड है पर कमाल की चीज है. It helps couple to achieve their parenthood. So today we are going to discuss about what exactly is this and is it really helpful. So often we see that couple are waiting for their parenthood and after trying for so many years, so they feel like कि अब क्या. So, is this the IUI the right choice, or they should directly opt for IVF? So, there are many myths associated with this that एज फैक्टर है तो आप IUI पे नहीं जाएंगे, आप सीधा IVF पे ही फोकस करेंगे. बट आज आपके साथ हम इन सारी चीजों के बारे में जानना चाहते हैं. Why IUI? What is the success rate? And yes, most important do's and don'ts related
Okay.
to this IUI. So over to you, ma'am, now.
Thank you. Thank you so much, Purnima. And I think this is a very important question for couples who haven't been able to achieve their happiness of conception, of having a conception. So I would say IUI is a step above natural intercourse, or what we call as timed intercourse, which often couples, do as a first mode of treatment before they jump into their higher, hierarchy of treatment. So IUI, as the name indicates, it's intra uterine insemination, which means that inserting or inseminating in the uterus a sperm sample. So obviously, when we put a sperm sample, we wash it. So it goes through kind of a circulation, the sperm sample goes through a spin in which all the kind of a dead and abnormal sperms are sieved off. And what we get is a sample which is little more neat and little more motile, little more fresh sample, which is instilled. And normally we instill this sample around the time of ovulation, which means when the egg ruptures, which is around 10th to 12th to 14th day of a period, we instill the semen sample into women's uterus. And that's why it's called as intra-uterine insemination. So kind of a next question of, when do we offer it, to be honest? Like I said, it is one step above natural intercourse. So couples who have been trying for, let's say, 3, 6, 9 months and haven't been able to achieve success so far in pregnancy, we go up the ladder in treatment and do advise them IUI. But at the same time, it's very important that certain criteria are met before we offer IUI. And when we say about the criteria, which means there are 4 important parameters which we keep in mind when we kind of counsel a patient about IUI. And among those 4, one is ovarian reserve. One is how is the sperm sample? It should not be too, bad for IUI. Another is how are the tubal status? And 4th is how is my uterine cavity? Is it okay to do it? Is there any problem in the negotiating the cervical loss? So all these 4 parameters should be checked. And above all these 4 parameters is the age of a woman, which is a very, very important and an independent indicator of my success. So once once we are satisfied that a woman has a good ovarian reserve, my sperm sample is fine, my tubes where the fertilization of egg and sperm is going to happen, we can offer a couple the process of IUI. And so the next question was, obviously we are intervening. As a medical specialist, we are intervening in their assistance of achieving a conception. How much success do we quote them? Because the hopes builds up as we intervene. The more we intervene, the more hopes build up. Having said that, I would say that IUI and natural conception, in a way, do not differ much in their success. The kind, I mean, as long as my parameters are fine, there are chances that we may achieve a success between 12 to 18 to 20% in a IUI cycle. And when we talk about IUI cycle, we always talk about a cumulative success, which means that sometimes a single IUI cycle may not give us the result what we are looking at. So we offer them 3 or maximum 4 cycles of IUI to give us a cumulative success of 35 to 40%.
Okay.
So it's very important that counseling at the beginning is important. That if they're going to intervene with IUI, they should be ready that there is a possibility we may have to carry on 3 or 4 cycles before we say, okay, this is not working, right? And let's
Right.
move up the ladder. So I think that counseling with the patient and a couple is very, very important.
Right.
So I think that's answered, first 2 questions, Purnima. And the
Right.
next question was the do's and the don'ts.
राइट सो मैम इससे पहले एक चीज सॉरी टू इंटरप्ट जैसे आपने बोला कि मैक्सिमम 3 to 4 साइकिल्स ऑफ आईयूआई सो ये साइकिल जो है वन आफ्टर द अदर मंथ के वी नीड टू हैव सम काइंड ऑफ गैप इन बिटवीन
Yeah. So this is very, very important. There's always, I would say, a myth also that we should give a gap in between the cycles, or some say that if we give back to back, we get a better oocyte egg number and all. So in a way, I would say it's very much individualized.
ओके
How one woman copes up with one cycle of IUI, then only we guide us, because for IUI we kind of aim for follicular growth, what we called as, or follicular growth means a follicle has an egg, so we aim for a follicular growth. Generally, if a woman is not pregnant, that follicle kind of what you say, that regresses back into its original position in that 1 month. But in some women, that leads to a persistent cyst formation or a persistent follicular cyst, and the woman takes a time to recover from that previous stimulation. So if a woman has recovered well from her previous IVF cycle, which we assess by ultrasound scan or sometimes by doing a blood test, we can definitely give back to back. But if a
ओके
particular woman has not recovered from her previous IVF cycle, which means she has some remnant of the previous follicle in the form of a cyst or something, then obviously we advise a gap or a break before we go on for the next cycle. So I would say now every treatment in assisted conception has become personalized, or what we say as individualized. So it all depends how a woman has come out with her previous IUI cycle. With
राइट
regards to success, I would say there's no difference. I mean, a success back to back IUIs give equal success as if giving a gap, as long as female partner is absolutely fine.
ओके राइट राइट So, ma'am, one more thing we are hearing nowadays is like double IUI cycle. So, please, उसके लिए भी थोड़ा सा आप बताइए.
So, a double IUI means that inseminating in the same cycle twice. So, like I discussed before, inseminate a washed semen sample into the uterus. So,
Right.
generally, we do it 24 to 40 hours after egg rupture, right?
Okay.
So, in double IUI, we do this insemination procedure twice, sometimes at 24 hours and again at 40 hours, right? So
Okay.
yeah, so it's double insemination, because generally if we don't do double insemination, we advise couples to have timed intercourse. But some
Okay.
couples, especially when the IUI is done for cases where there is a problem with intercourse, or male
Hmm.
problem with penetration or erection or whatever, or if it's a donor IUI cycle, in these cases double IUI, I would say, can be indicated. But if a couple who is consummating normally and no problems in intercourse, the double IUI does not offer much advantage over the single IUI.
Okay. Okay. So, I think we have busted the first myth That double IUI doesn't mean that double success rate.
No, no, not at all. So if a couple is having good intercourse, normal intercourse, it does not offer any benefit.
Right. तभी मैंने बोला छोटा सा वर्ड है लेकिन चीजें बहुत सारी हैं जो इससे जुड़ी हुई हैं एंड मैम next was like do's and don'ts for this IUI. Any specific things like?
Yeah. So I think the most important dues is, I mean, I always start when I counsel my patients for, IUIs or IVF. The most important is the counseling and expectations. Very important, because that not only helps my patients to stay positive, but also not to lose hope if IUI is not successful, because the
Right.
limitation is in one cycle, IUI can offer us 15, 18, maximum 20% success rate, which means one in five. So the couple, I mean, has to be positive when they start this treatment. So that is the positive approach towards IUI is important. Second is the right patient selection. So I would say when we say do's, we should offer to only those couples who fit the criteria. Not everybody can be offered this treatment. So right patient selection is very, very important. And with regards to, I would say do's, like let's say that what should we do to optimize our results? Like I said, patient selection, positiveness, counseling, and I would say these are the facts. Now, the myths, a lot of myths, which I mean, obviously, this has all come from our patients. Is
Right,
should I,
right.
stop working when I'm getting my IUI done? Should I go on a complete bed rest when I'm getting my IUI done? And how long should I wait in the hospital when I get my IUI done? So all these questions, always come up from our patients. So if answering that question, the most common is, I mean, do I need to go on a complete bed rest after IUI? And I would say no, no, it's not needed, because it's like IUI is very much like natural conception. The way
Hmm.
couples get pregnant, naturally, and sometimes we don't even know that we are pregnant. So
Right.
doing IUI does not mean that we create that kind of a fear in a patient's mind that it's something big has been done and you have to take a bed rest or complete stop all your activities. I always advise that the more natural life you keep, if you're working, keep on working. The more de-stressed life you keep, the better are the outcomes. But yes, at the same time, post IUI, I do advise that avoid the hard chores of daily routine, like not lifting anything from the floor, any heavy stuff which puts a strain on her abdomen, because we
Okay.
know things are happening inside. So all those precautions and cautions, I would say that we do advise, but there, as such, there is nothing don't that you should not do, because we want IUI is a very simple procedure and we want to keep it simple and natural. And the beauty of IUI is it's less invasive. So we want to keep it as much natural as possible. And this is only possible when our counseling is better and we don't scare our patient too much, that you don't
Right.
have to do this, and this. So a little, so IUI is, I would say, a little assisted conception. So assistance is given, but not at the expense of scaring them. You want to keep it as natural as possible as
Right.
well.
Right. And what about the protocol of medications, ma'am? So
Yeah.
it also depends on varies patient to patient, or
Hmm.
this protocol is related to somewhat age of the patient also.
Hmm. So yeah, so protocol wise, I would say there are, I mean, a lot of protocols which are followed in IUI. There is a natural cycle protocol where we do not give them any assistance with the egg growth. So let me clear
Okay.
that what is protocol. Protocol means
Right.
that we are assisting with the egg growth, right? Because naturally, in a natural cycle, when we don't give any assistance, generally one follicle comes up. But when we assist a couple with, let's say, IUI or so, we expect that there should be at least one or two follicles. I mean, not obviously more than three. So for this
Okay.
assistant, we try to give them some medications, which can be in the form of oral tablets or which can be in the form of injectables.
Okay.
So, and hence the IUI, depending on my patient choice, it can be in a natural cycle where obviously I will have hopefully one follicle, an assisted cycle with medicines, which may give me two follicles or three follicles, and assisted with injections, which can again give me two or three follicles.
Okay.
So these protocols can be followed. And when, I mean, we normally do a follicular monitoring over the course of next 10, 12 days till that follicle is mature. We kind of help in assisting in rupturing it, and then we plan an IUI. Right? And how do I choose the protocol which to follow in which patient? It all depends on the indication for which I am doing an IUI for. So let's assume I am doing an IUI for a case of mild male factor, where there is a kind of a mild motility issue of the sperm, right? And I'm
Mm-hmm.
doing IUI because I am releasing the sperms closer to the site of fertilization in the uterus. So in that case, if the female, she has got a regular ovulatory cycle, her ovarian reserve is normal, she doesn't need any assistance with any medication. She's forming her more own follicle, and I am doing only IUI for a mild male factor, so I would not give her any medication, right? And I would just,
Okay.
and we get very good results. So this is called as natural cycle IUI. So let's say there's a couple or a female who has got polycystic ovaries or doesn't get enough good growth of her eggs, and I need to assist
Mm-hmm.
her follicular growth. In those cases, I may give medications or I may give her injectables. And
Okay.
then there are certain scenarios like where there is a patient where what we called as hypogonadotrophic hypogonadism, where basically her brain hormones are completely suppressed and they cannot
Mm-hmm.
make any follicles. So in those cases, definitely I'm going to give her only injectables. So what kind of
Okay.
protocol I choose will all depend on what kind of my patient is. So again, it's very much individualized.
थैंक यू डॉक्टर, थैंक यू डॉक्टर पुनीत सो मच। शुरू छोटे से किया था बट एंड करते करते हम बहुत सारी चीजें सीख गए आपसे एंड इट्स रियली ग्रेट टू हैव यू एट अ प्लेटफॉर्म। बहुत सारी चीजें हमने सीखी, बहुत सारे मिथ्स हमने ब्रेक किए एंड यस मोस्ट इम्पॉर्टेंटली हमने समझा कि व्हाट एग्जैक्टली इज आईयूआई और ये किसके लिए है किसके लिए नहीं है, दैट इज ऑल्सो इम्पॉर्टेंट। So
Thank
thank you, ma'am. Thank you
you.
so much for joining us. Thank you.
Thank you, Purnima. Thank you to Fertility Dost. And thank you to Shield, for all their efforts. And I would say, wonderful kind of awareness programs you do. And I'm so happy for that patients do get the right information. They don't have to look for Google and all, which sometimes I feel just gives them unnecessary information which is not needed. So you guys
Right,
are doing
right.
a wonderful job. Thank you so much for that. Thank you.
Thank you, ma'am. Thank you.